Hey everybody, it's Nikki the Baby Whisperer with your pro tip. It's the third one. I'm getting ready to just blow your mind. You ready? If you plan on returning to work and having to pump, in those first couple of weeks of breastfeeding, you don't need to pump. That's the best advice, the most professional advice anyone should give you when you are wanting to make breastfeeding successful. Because pumping isn't a part of successful at breastfeeding. Pumping is a part of you and plays a role in you returning to work, but you're not returning to work in those first few weeks of breastfeeding. You don't have to pump. It's one of the worst recommendations anyone can give you. If your baby is gaining weight, having adequate wet and poopy diapers, you're in those first few weeks, things are going okay, right? It's not great. It's not great for anybody. You don't have to pump. That's not even like a professional tip. That's just common knowledge. Pumping is not necessary at all until it's time to give a bottle. Then you pump because you're giving a bottle. And yes, I know. You guys are wanting to prepare for work. You want to have a little in your freezer. Great. Here's my professional tip. Get good at one thing at a time. Get good at breastfeeding. Because, listen, breastfeeding is the best way to make milk at breast. Best way to make milk. Then, once you get good at that, then you can incorporate one pumping session at or around 4 weeks. Whew, that just took a big load off your shoulders, didn't it? I hear so many moms who are breastfeeding and pumping and breastfeeding and pumping, and then they're fighting that battle of, well, what if the baby starts to eat? I got to pump. No, you don't. You just got to feed your baby. You've got to feed your baby. Unless you're going to give your baby a bottle, you don't have to pump. Especially if you don't have to give your baby a bottle for weeks. You don't have to pump. Now, I know everybody's like, oh, no, but I need to. Okay, listen, one time a day, fine. If you feel like you're like, I got to do it, one time a day, one. Just one. Feel the weight lift off your shoulders? You want good milk supply? Baby to breast. That's the best. Baby to breast, on demand, very frequently, as much as they want. That's going to bring you way better milk. And you're not going to be stealing food and worrying about if it's time to eat or not time to eat. None of those things. That's pro tip number 3. Comment below if you have questions.